I want to speak not about cases which I can't count or deaths which I don't trust, but the hospitalization surge and this insanity over the long weekend that we can't get vaccinated fast enough. What is the Nabarro solution to jumpstart the rate of vaccinations and double dose vaccinations?
Thanks very much indeed. There is no alternative but to make vaccines available as widely as possible as soon as they get approved. I don't want any corners to be cut on the approval process, so each vaccine must go through their phase 3 trials and then be properly assessed by national regulators as well as by the World Health Organization. But that's the only option that we have if we're going to rely on vaccines to get this pandemic to subside. Just one last point. Vaccines won't be enough on their own. We will need to continue to pay attention to the rules that were set over the last few months about physical distancing, mask wearing, isolating when sick, looking after those who are frail and vulnerable, because these basic principles, backed up by strong public health work at local level, still will be key for the coming months, even years, to enable societies to get on top of this pandemic.
Dr. Nabarro, there were trials with vaccines, and they told us, for example, Pfizer, that you take the first dose and then you have to take a second dose after 3-4 weeks. Does it make a difference? And how much of a difference if you delay that second dose by months?
What we're seeing now is more and more countries wondering whether a widespread use of a single dose of one of these vaccines may in the end be more effective at helping slow down the pandemic and reduce suffering than making sure that everybody receives their 2 doses at 4 weeks or so intervals. I am not really at this stage able to come out in favor of one option or the other, because they are so situation dependent. The move towards a longer interval between vaccine doses reflects an anxiety in some countries that this situation is so intense that to protect health services, getting single shots into as many people as possible is the only right way to go. But as you picked up during the last few days, there's been quite a lot of controversy over exactly how to go down this quite experimental path.
Yeah, there's also a lot of controversy and, a lot of citizens calling it symbolic vaccination programs, because a lot of the European countries have the vaccines, but they're just not administering them quickly enough. Would you ask countries to be quicker, to find more ways of finding pharmacies, for example, to administer these vaccines, not only hospitals?
Yeah, so what this really means is that the administration of vaccines must be thoroughly planned. We know from so many different campaigns that if you don't have proper planning at local, state, national, regional and global level for the use of scarce vaccines, especially when you're in a crisis situation, you can end up with a lot of waste and indeed quite a lot of potential errors being made. I really would like to appeal to every leader just to really slow down a bit on the rush to get the vaccine into as many arms as possible and put more time into systematic planning of what has to be a really effective global operation.
David, you went right where I want to go. I want to go to you on this and then to Cliff if we have time. Dr. Nabarro, this is real simple. It's about federalism versus state distribution as well. Do you have any optimism or any track record that the United States can provide a polio equivalent or a diphtheria equivalent from 100 years ago, 120 years ago? Can we do that with the state mess we're in versus a federal application?
Well, you will anticipate, Tom, that I'm going to have to say not only should there be national and state planning that is done from the center in the United States, there's also got to be global planning. This is a global pandemic, accelerating fast.
Okay.
And we must have a global response.